Hello, my name is Bożena Kostek. I'm from Gdańsk University of Technology, Poland, and I would like to introduce the topic of enunciation as a critical factor in medical transcription systems. A question arises as to whether enunciation plays a role in ensuring accuracy in medical terminology transcription. But to make an analogy, it is a bit like an L2 speaker like myself. So it seems that the answer, tentative answer, is yes. According to the research purpose, the focus was on both acoustic and lexical features, and then the evaluation of the STT system using various metrics. Of course, for that we needed and employed several large language models. We research challenges. They are particularly related to specialized medical terms, deciphering acronyms, the Polish language, which is underrepresented in large language models, noisy environments, and the impact of stress. So this is an example of a comparison of scenarios with proper, this is the top left figure, and unclear enunciation. So I can say that differences are visible even without detailed analysis. So this really translates into significance of a clear enunciation in improving STT accuracy. And following this is an overview of the ASR and STT models used, including recurrent neural networks and transformers such as Whisper, and applied to challenges that were posed by specialized medical spoken language. And these slides, this is the key findings. This slide highlights and stress the need for analytical exploration and even more systematic approach to solving these complex problems in STT application to medical speech. This is shown in terms of accuracy. We can see that proper enunciation brings more than 20 percentage points, which is huge. To take away, I think it is important to break down the complex problem into more detail, discovering features that are important, but first of all, I think that first of all, gather more examples. We need many recordings of medical health care people, medical doctors, and so on. On the other hand, if we look into future directions, I think that they include looking for effectiveness under noisy conditions, handling specialized jargon, exploring enunciation thresholds. This can be quite interesting, and expanding the underrepresented languages. And above all, we should ensure data anonymization. And this study was supported by the Polish National Center for Research and Development. Thank you for your attention, and questions. NL2 speaker. Thanks.
Bożena. Thank you, Bożena. That was really interesting, and thanks for sharing your research. We're going to field questions for your session now, so you can turn on your camera and unmute.
Yes, I am. I'm on.
There you are. I'm gonna make sure that you're spotlighted, although think you are. Okay. Awesome. So thanks again. I'm gonna go over to our Q&A function. So anyone who wants to submit a question, please use the Q&A versus the chat. The chat gets a little too cluttered to follow with all the questions. So the Q&A function is you may have to click on the More button on the toolbar and just click Q&A. And please use that to submit your questions, and I'll go through them in order. And those questions won't be viewable until they've been answered. So that kind of helps us, it helps us parse them out and make sure we're keeping up with them. So first off, for Bojana, we were hearing from Hannah Daniel. Did you find that accents or dialects gave different results on transcription accuracy, regardless of enunciation?
I can say that we didn't, we have, I mean, most of our speakers, I mean, healthcare practitioners, they were Polish. So there is no really an issue with accent or dialects. This is not a real accent. I mean, this is not a real problem. The problem is that, you know, I think that the biggest problem is acronyms, which differ even between specialization within the same clinic, within the same hospital. So I have many such examples, and it's really interesting to see when because we have this project, we are working along with medical doctors, and they are cardiologists, and we ask them to fill in some acronyms and some abbreviation because they are later read also by the students and so on, and they were not able to do that. I mean, not all of them, because they are so specific to the specialization. So this is, I think, the one of the biggest problem. And the other one, it's typical noisy conditions. So it's really difficult to discern in the recording. And moreover, if it is a real scenario when there is, you know, I'm not saying catastrophe, but there is some, you know, problematic patient and so on. So it's a stressful situation. So the doctor typically raises his or her voice, and then it really becomes, it is, I'm not sure whether you are aware about the Lombard, the so-called Lombard speech. It's not only a higher volume, but it changes timbre and so on. And it's again something that it's really difficult to discern. And coming back to enunciation, I can say that, you know, people really talk with various speed, various not accent, but accentuation, you know, maybe, yeah. So it's a little bit different thing for me, especially as I listened to these recordings, so I can discern in Polish. There are many differences. So it's a long answer to your question.
No, I understand what you mean, and thank you for sharing that. Our next question is from Avery Thompson, and he's asking, could you explain more about what too much enunciation is and why it's a problem?
Yes, I can say that, you know, because this is not for someone like me. I mean, when I am listening to these recordings, when it's a clear enunciation, that's really fine, because I can discern every word and I can, you know, focus on abbreviation or an acronym and so on. But, you know, it may be too much for the model, I mean machine learning model, because we don't have too many such examples. Typically, people, it's a little bit. Some people, when they are when they read this record, I mean, because we record them, yes, and some of them they read rather than or dictate rather than speak. So this is the difference, and if we don't have too many examples of each category, then we don't have enough examples, resources to teach the transformer, because all these large language transformers, we still don't have these kinds of transformer that was built on Polish language. They are built on mostly in English. So we teach this model with Polish examples, but we have something around 12,000 phrases, I mean, with this abbreviation. And so, I mean, this is medical text. And then we have now more than 200,000 recordings with all these examples, but still this is not enough to make this. So to discern between this, very clear enunciation, which is, I can say it in Polish, but not really in English, but you can, I think that I can explain this easily. So I think this is the problem. So what I am saying that we are also looking for something like threshold. I mean, whether and the other thing, it's we synthesize also, because it's not only recordings. There are also recordings based on the synthesis, speech synthesis. So it's not speech to text, but it's text to speech. And once again, these systems were taught on English rather than Polish. So once again, we don't have such clear enunciation, and we don't have, on the other side, we don't have very quick speech, because it's a little bit like what I can say, these models that transfer speech, I mean text to speech, there are nice voices, and they just use quite clear enunciation, but there is not much differentiation between the speakers, even if timbre differs.
I see. Thank you so much for clarifying that, Bożena. And thank you for all the questions. Anyone or journalists who'd like to see the embargoed press release on Bożena Kostek's research can access it with the link in the chat. There's a press release there, and this session is embargoed as well until Thursday, November 21st, and the time for this one is 3:25 p.m. Thank you so much, Bożena.
Thank you.